Welcome back. With me is one of my very special guests, Dr. Desimone, probably one of the finest knee and shoulder surgeons in the country. And you're right here in South Florida. And what we'd like to do is talk about prevention, treatment, and some of the more special things you have for the audience.
We're seeing a lot of injuries now, Gerard. I think a component to the number of injuries that we're seeing in this community is because athletes are playing sports all year long. And I think that they're overconditioned. They're often tired, probably dehydrated towards some of the later summer events. And we're commonly seeing knee-related injuries and lower extremity-related injuries, such as ankle sprains. I'll sometimes see mild injuries in patients with knee-related sprains, and those are pretty easy to treat. Usually the typical RICE, the rest ice, compression elevation, will accommodate their needs, and within 2 or 3 days they'll probably be back to full activities and eventually playing sports again.
And doing the same injury.
Yes.
Right.
Sometimes, hopefully not.
Right.
But with the more severe injuries, we're commonly seeing, we will sometimes see a patient that will present to us after significant twisting injury to the knee, and they'll have significant swelling, they'll have a sensation of instability, and they'll have weakness, and they'll be unable to accommodate weight to that lower extremity. And these are the patients that need to be evaluated immediately. So, with that, some of the initial assessments that we can do is we could see them in the office. They'll usually have swelling in their knee. They'll usually have restriction of motion. X-rays will commonly be normal. They won't have any evidence of fracture, but we can sometimes get an MRI, which is a specific tool to look at the soft tissue injuries and the bony anatomy, and this will provide information with regards to the soft tissue ligamentous structures. And one of the common injuries that we're seeing right now are ACL injuries, which is consistent with the anterior cruciate ligament, which is one of the major supporting ligaments in the knee.
And we're going to look at that.
That's
We're going to
correct.
actually look at it. We're going to see it in real life, and you actually have a model of it to show exactly the
correct.
components of it.
And what I'd like to do is I'd like to introduce you to one of my patients, and I'll show you a little bit about what a loose knee looks like in somebody who's been extremely active playing rugby for his whole life.
Great. Let's check out the loose knee.
I would like to thank Nick for joining us here tonight. Nick is one of my patients. He's 21 years of age. He's an avid rugby player. He's been playing rugby for several years and presented about 2 months ago with a twisting injury to his right knee while playing. And Nick, why don't you tell us a little bit about what happened?
All right. Well, when it first happened, I felt like on the field, obviously, felt like a clicking or like a pop inside my knee. I wasn't able to get up from that, had to be carried off the field, and soon after that the swelling started, and it swelled. It was massive when it swelled up. Wasn't able to walk in it for about a week, and that's when I came to your office.
You know, very commonly with these type of injuries, you'll see a lot of swelling. And this is classic and typical of an ACL injury, an anterior cruciate ligament injury. When he presented to my office, he did have a lot of swelling, and he was unable to fully flex and extend his knee. He was barely weight-bearing comfortably. He was walking with a limp. And I got an exam on him, including an X-ray, and for the most part, there was no evidence of fracture. And what we did is, additional to this, is we got an MRI. And with my clinical examination, which I'd like to show you, and as well as the MRI, we were able to determine that he not only had a ligament tear, but he also had a cartilage bumper tear called the meniscus tear. What I'd like to do is, when a ligament is disrupted within the knee, that will often allow motion between the two bones. And if you could see with Nick's knee, he has a lot of motion between his thigh bone and his leg bone. And you could see how the leg bone comes anterior. And what this does is it causes and creates a sensation of instability that will allow the knee to give out and slip and slide. And what we're going to do with Nick is we're going to treat him operatively. We're going to reconstruct his ligament. And what I like to do is I'd like to show you a model of a knee. And this is similar to Nick's knee. And what we do is we first look at the knee arthroscopically. And one of the things that we like to do is evaluate the knee for any concomitant meniscal or cartilage injuries. And this is, if you can get a close-up of this is a structure called the anterior cruciate ligament, which Nick had disrupted during this particular event. What I'd like to do is I'd like to go in and reconstruct that ligament. And what I like to do is I'd like to take a little slip of the patella tendon, and there are different treatment options for this. Sometimes we could take hamstrings, or sometimes we can even use cadaver graft, but I personally like this because he's an extremely active young male. He likes to play those load twisting activities, and this is the type of graft that will heal very quickly and will heal without a rejective phenomenon. So this will allow him to get back to activities. He'll wear a brace for probably about 10 days. We'll get him into physical therapy with a local facility, Health South, and they know very much my protocols, which are an accelerated protocol to allow him to get back to functional activities and sports in probably a 6 to 9 month period. I would like to thank Michelle for being with us tonight. Michelle is one of my patients. She's a 30-year-old who was actually skiing and had a significant twisting injury to her left knee. She presented to me probably about 5 months ago and had significant pain, swelling, the inability to ambulate, and also presented with a significant instability with a diagnosis confirmed with an anterior cruciate ligament injury. She's 4 months out from surgical reconstruction, and what we did is, you could see her scar. Her scar is through a limited surgical technique. I like to do this arthroscopically, and I use a little tiny scar to harvest our graft, and I use a central slip of the patella tendon. I bring that within the knee, and I stabilize that ligamentous structure to create a new anterior cruciate ligament. What I'd like to do now is I'd like to examine her knee, and we'll show you the difference in stability compared to Nicholas. Again, we look at the knee for stability in the anterior plane, and if we check the stability, she's got a nice, solid, firm, stable knee. And I think that's great, and I think you've done very well. She has minimal swelling, all of her wounds are healing well, and she's got good quad strength, which is extremely important because she's been very diligent with her physical therapy through Health South and has implemented a range of motion strengthening program, and she's back to some functional activities. Tell me what you're doing now with yourself.
Walking, biking, stair climbing, weight training.
Okay. And how are your symptoms now? You're 4 months out from a big operation.
Yeah, they're excellent. I don't have really any symptoms. You really can't even tell that I've had the surgery.
Okay.
It's working really great.
And I think that's great. The key is with Michelle is that we're going to wait a little bit until this graft incorporates, which will allow it to be strong, and at the 6 to 9 month mark will allow her to return to some of the repetitive, the load twisting activities that we like to usually get our patients back to.
That's probably some of the most incredible things I've seen. You basically do marvelous work. And tell me, from here, let's hear the pearls of wisdom for the community. What can they do to prevent these kind of things and get the best care if these injuries occur?
I think it's important to note when you have an injury and when you have a mild sprain versus a significant injury. I see a lot of our young athletes in the community, they present to me 2 or 3 months out because they're really not sure whether or not they have a substantial injury. They'll go back to play sports, their knee will give out, and they'll have a subsequent injury like a cartilage injury, which can be devastating for a knee. I think with the symptoms of pain, swelling, sometimes the inability to ambulate, to put weight on that lower extremity, make sure that you take the time to get in to see a physician who is subspecializing in knee-related injuries. I also would like you to do that because that's important with regards to making the proper diagnosis and allowing us to get back to functional activities. I see some patients come to my office, young athletes, where they've sometimes been misled for a couple of months, and then they go back and play sports,
right,
and then they'll have a subsequent injury, which can sometimes be devastating in the young population.
Sure. Well, you've been super with your time.